Fasting explained in detail by Dr. Rohit Deshpande. Fasting is a practice that has been followed by humans for centuries, encompassing various physiological, medical, and religious contexts. It involves abstaining from eating and sometimes drinking for a certain period. From a physiological perspective, fasting can refer to the metabolic state of a person who has not eaten overnight or the state achieved after complete digestion and absorption of a meal. The metabolic changes that occur during the fasting state begin a few hours after eating. After the absorption of a meal, the body goes through a series of processes to break down and utilize the nutrients obtained from food. Once these processes are complete, the body enters a fasting state where it relies on stored energy sources for fuel. During this period, various changes take place in the body to maintain energy balance and ensure proper functioning. In the medical field, fasting plays a crucial role in diagnostic procedures. A diagnostic fast involves refraining from eating for a specific duration, usually ranging from 1 to 100 hours depending on the age of the individual. This type of fast is conducted under medical supervision to investigate health complications, particularly hypoglycemia. By observing the metabolic changes during the fast, healthcare professionals can gain insights into the underlying causes of certain medical conditions and develop appropriate treatment plans. Furthermore, fasting is often employed as a preparatory measure for medical procedures, surgeries, and tests. Prior to a colonoscopy or surgery, for example, patients are often required to fast to ensure the digestive system is empty, allowing for clearer visualization or reducing the risk of complications during the procedure. Similarly, fasting may be necessary before specific medical tests to obtain accurate results. Intermittent fasting is a popular technique used for weight loss and overall health improvement. It involves incorporating regular fasting periods into one's dietary schedule. Common intermittent fasting methods include the 16/8 method, where an individual fasts for 16 hours and restricts their eating to an 8-hour window, or alternate day fasting, where a person fasts every other day. Intermittent fasting is believed to have various health benefits, such as improving insulin sensitivity, promoting weight loss, and supporting cellular repair processes. Religious rituals often incorporate fasting as an integral part of their observance. Different religions have specific fast days and periods determined by their respective traditions and beliefs. For example, Muslims observe a month-long fast called Ramadan, during which they abstain from food and drink from dawn to sunset. Fasting in a religious context serves as a spiritual practice, promoting self-discipline, mindfulness, and reflection. While fasting can have numerous benefits, it is important to approach it with caution and consideration for individual health circumstances. Some people may have medical conditions or dietary requirements that make fasting unsuitable or potentially harmful. It is advisable to consult with a healthcare professional or a registered dietitian before embarking on any fasting regimen, especially if there are pre-existing health concerns. Health effects of fasting can vary depending on the circumstances and the specific conditions being addressed. Researchers have conducted studies to explore the impact of fasting on different health situations and have discovered intriguing findings. In a study conducted at the Yale School of Medicine, researchers led by Ruslan Medzitov investigated the effects of fasting on mice with bacterial or viral illnesses. They observed that providing carbohydrates to mice with bacterial sepsis had detrimental effects, while denying glucose or blocking its metabolism was lethal. However, when it came to viral sepsis or influenza, nutritional supplementation with carbohydrates proved beneficial and decreased mortality rates. These findings raise questions about how our bodies may react differently to fasting depending on the nature of the illness, whether it is bacterial or viral. The researchers emphasized the need for further exploration in human studies to understand whether similar patterns occur in our bodies during illness. Alternate day fasting is a fasting method that involves alternating between a 24-hour fast day, during which the person consumes less than 25% of their usual energy needs, and a 24-hour non-fasting feast day period. This approach has shown promising results in improving cardiovascular and metabolic biomarkers, comparable to those achieved through calorie restriction diets, especially in individuals who are overweight, obese, or have metabolic syndrome. Studies have indicated that alternate day fasting can have positive effects on weight management and cardiometabolic health markers. A recent review conducted in 2021 examined the impact of moderate alternate day fasting over a period of 2 to 6 months in overweight or obese adults. The findings demonstrated significant reductions in body weight, body mass index, BMI, and cardiometabolic risk factors. This suggests that alternate day fasting can be an effective approach for weight loss and improving various health parameters in individuals struggling with excess weight or obesity. While these studies provide promising insights into the potential health benefits of fasting, it is essential to approach fasting practices with caution and individual consideration. Fasting may not be suitable for everyone, particularly those with underlying health conditions or specific dietary requirements. Consulting with a healthcare professional or a registered dietitian is crucial to ensure that fasting is safe and appropriate for an individual's unique circumstances. Moreover, it is important to note that fasting should not be viewed as a standalone solution for health improvement. A balanced and nutritious diet, regular physical activity, and overall lifestyle choices play integral roles in maintaining good health. Fasting can be utilized as a complementary strategy within a comprehensive approach to wellness. Fasting plays a crucial role in various medical applications, particularly in the preparation for surgical procedures and certain diagnostic tests. The practice of fasting prior to surgery aims to minimize the risk of complications, specifically the aspiration of gastric contents during the induction of anesthesia. Additionally, fasting is necessary for specific medical tests to ensure accurate baseline measurements. One of the primary reasons for fasting before surgery is to prevent pulmonary aspiration, a potentially life-threatening condition. When a patient undergoes general anesthesia, there is a risk of vomiting and inhaling the contents of the stomach, leading to aspiration pneumonia. By fasting prior to surgery, the stomach is emptied, reducing the likelihood of regurgitation and subsequent aspiration of gastric contents during anesthesia induction. This precautionary measure is crucial for patient safety and to minimize the risk of complications during surgery. In addition to surgical procedures, fasting is also required for certain medical tests to establish accurate baseline measurements. For example, cholesterol testing, also known as a lipid panel, typically requires fasting for several hours before the blood sample is collected. It allows for a clear assessment of lipid levels in the bloodstream, particularly triglycerides. Failure to fast for the recommended duration, typically 12 hours including the avoidance of vitamins, can lead to elevated triglyceride measurements, which may affect the accuracy of the test results. By fasting prior to cholesterol testing, healthcare professionals can obtain a more accurate assessment of a person's lipid profile. This information is crucial in evaluating the risk of cardiovascular diseases and determining appropriate interventions or treatments. Fasting for the recommended duration ensures that the test results reflect the true baseline levels of lipids in the bloodstream, providing valuable information for diagnosis and treatment planning. Certain blood glucose measurements require fasting to establish accurate baseline values. Fasting blood glucose tests are commonly used to diagnose diabetes or monitor blood sugar levels in individuals with known diabetes. By fasting for several hours before the test, usually overnight, the test results reflect the body's fasting glucose levels without the influence of recent food intake. This fasting period allows healthcare professionals to obtain reliable information about a person's blood sugar regulation and make informed decisions regarding diabetes management. It is essential for individuals undergoing medical procedures or tests that require fasting to follow the specific instructions provided by healthcare professionals. These instructions may vary depending on the type of procedure or test, and it is crucial to adhere to the recommended fasting duration and guidelines. Failure to fast as instructed can lead to inaccurate test results, potentially impacting diagnosis, treatment decisions, and overall patient care. While fasting is an important aspect of medical applications, it is important to note that it should be conducted under the guidance of healthcare professionals. They can provide specific instructions tailored to an individual's health condition, medications, and overall well-being. It is advisable to discuss any concerns or questions regarding fasting with the healthcare team to ensure a safe and effective fasting period. Mental health is an essential aspect of human well-being. It refers to a person's overall psychological state of being, including their emotional, cognitive, and behavioral functioning. Mental health plays a crucial role in one's daily life, affecting their relationships, work, and general quality of life. Therefore, it is essential to maintain and improve mental health to achieve a fulfilling and satisfying life. Mental health issues have become increasingly prevalent in today's society, with more and more people experiencing symptoms of anxiety, depression, and other mental disorders. These conditions can be caused by a range of factors, including genetic predispositions, life events, and environmental factors such as stress and trauma. It is essential to address these factors and seek treatment to manage mental health issues effectively. One potential approach to improving mental health is through fasting. Fasting is the practice of abstaining from food for a specific period with the intention of improving physical and mental health. While the primary benefits of fasting are often associated with weight loss, recent research has suggested that fasting can also have significant mental health benefits. One study published in the Journal of Psychiatric Research found that fasting could improve overall symptoms of depression. The study involved 80 adults with depression who were randomly assigned to either a fasting group or a control group. Participants in the fasting group were asked to fast for 16 hours per day, while those in the control group were asked to maintain their normal eating patterns. The results showed that participants in the fasting group experienced a significant reduction in depression symptoms compared to those in the control group. Fasting has also been shown to improve cognitive performance. In a study published in the Journal of the International Society of Sports Nutrition, researchers found that fasting improved cognitive function in athletes. The study involved 16 male athletes who were asked to fast for 12 hours. The results showed that fasting improved reaction time, alertness, and mood compared to the control group. Furthermore, fasting has been linked to improved subjective feelings of well-being. A study published in the Journal of Alternative and Complementary Medicine found that fasting for just one day could improve mood and overall well-being in healthy individuals. The study involved 30 healthy adults who fasted for 24 hours. The results showed that participants reported feeling more energetic and less tense after the fast. It is essential to note that fasting may not be suitable for everyone, especially those with certain medical conditions or eating disorders. It is important to consult with a healthcare professional before embarking on any fasting regimen. Mental health is an essential aspect of human well-being. It refers to a person's overall psychological state of being, including their emotional, cognitive, and behavioral functioning. Mental health plays a crucial role in one's daily life, affecting their relationships, work, and general quality of life. Therefore, it is essential to maintain and improve mental health to achieve a fulfilling and satisfying life. Mental health issues have become increasingly prevalent in today's society, with more and more people experiencing symptoms of anxiety, depression, and other mental disorders. These conditions can be caused by a range of factors, including genetic predispositions, life events, and environmental factors such as stress and trauma. It is essential to address these factors and seek treatment to manage mental health issues effectively. One potential approach to improving mental health is through fasting. Fasting is the practice of abstaining from food for a specific period with the intention of improving physical and mental health. While the primary benefits of fasting are often associated with weight loss, recent research has suggested that fasting can also have significant mental health benefits. One study published in the Journal of Psychiatric Research found that fasting could improve overall symptoms of depression. The study involved 80 adults with depression who were randomly assigned to either a fasting group or a control group. Participants in the fasting group were asked to fast for 16 hours per day, while those in the control group were asked to maintain their normal eating patterns. The results showed that participants in the fasting group experienced a significant reduction in depression symptoms compared to those in the control group. Fasting has also been shown to improve cognitive performance. In a study published in the Journal of the International Society of Sports Nutrition, researchers found that fasting improved cognitive function in athletes. The results showed that fasting improved reaction time, alertness, and mood compared to the control group. Furthermore, fasting has been linked to improved subjective feelings of well-being. A study published in the Journal of Alternative and Complementary Medicine found that fasting for just one day could improve mood and overall well-being in healthy individuals. The study involved 30 healthy adults who fasted for 24 hours. The results showed that participants reported feeling more energetic and less tense after the fast. It is essential to note that fasting may not be suitable for everyone, especially those with certain medical conditions or eating disorders. It is important to consult with a healthcare professional before embarking on any fasting regimen. Complications are potential risks or adverse outcomes that can arise from various activities, interventions, or treatments. When it comes to fasting, a practice that involves abstaining from food or water for a certain period, there are potential complications to be aware of. One such complication that can occur in rare cases is known as refeeding syndrome, which can be potentially fatal due to electrolyte imbalance. Refeeding syndrome is a condition that can develop when an individual resumes food intake after a prolonged period of fasting or severe calorie restriction. This syndrome occurs due to rapid shifts in electrolyte levels, primarily phosphorus, potassium, and magnesium, as well as changes in fluid balance. These imbalances can have serious implications for multiple organ systems, including the heart, lungs, and nervous system. While refeeding syndrome can potentially occur after any period of prolonged fasting or severe calorie restriction, it is more commonly associated with longer fasts, such as extended water fasts or dry fasts. Dry fasting, specifically, involves abstaining from both food and water for a designated period. It is an extreme form of fasting that requires careful consideration and supervision due to the associated risks. During a dry fast, the body's water and energy requirements are typically met through internal metabolic processes. The absence of external fluid intake can lead to increased reliance on the body's water stores and an accelerated breakdown of glycogen, stored glucose, for energy. As a result, the body may undergo significant metabolic and physiological changes. When a person undergoing a dry fast reintroduces food and fluid intake, there is a risk of refeeding syndrome. This occurs because the body, which has become adapted to a state of water and energy conservation, suddenly receives an influx of nutrients and fluids. The body's response to this sudden change can disrupt the delicate balance of electrolytes and fluid distribution. The symptoms of refeeding syndrome can vary but commonly include fluid retention, electrolyte imbalances, such as low phosphorus, potassium, or magnesium levels, cardiac disturbances, respiratory issues, muscle weakness, and neurological symptoms. If left untreated, refeeding syndrome can lead to severe complications, including cardiac arrhythmias, respiratory failure, seizures, and even death. It is important to note that refeeding syndrome is relatively rare and typically occurs in individuals who have undergone long periods of fasting or severe malnutrition, particularly those who are already nutritionally compromised or have certain medical conditions. However, it is crucial to be aware of the potential risks associated with fasting, especially when it comes to more extreme forms like dry fasting. To minimize the risk of refeeding syndrome or other complications, it is essential to approach fasting with caution and seek guidance from healthcare professionals, particularly if considering prolonged or extreme forms of fasting. Medical supervision and monitoring can help ensure that the fasting regimen is safe and appropriate for an individual's specific health circumstances. Throughout history, scientists and researchers have conducted various medical studies to understand the effects of fasting, famine conditions, and extreme dietary interventions. These studies have provided valuable insights into the physiological and metabolic responses of the human body in times of limited food intake. In this article, we will delve into some significant historical medical studies, their findings, and the implications they have had on our understanding of nutrition and health. During times of famine and scarcity, researchers have had the opportunity to study populations experiencing extreme hunger. One such notable study took place during the Second World War when the Dutch population faced severe food shortages. Known as the Dutch Famine Study or the Hunger Winter Study, this research provided crucial insights into the long-term effects of malnutrition and the impact on subsequent generations. The Dutch Famine Study, conducted between 1944 and 1945, involved pregnant women in the Netherlands who experienced limited food availability and suffered from malnutrition. Researchers followed the offspring of these women and discovered a higher prevalence of chronic diseases, such as obesity, diabetes, and cardiovascular conditions, in individuals who were exposed to malnutrition in utero. This groundbreaking study shed light on the concept of developmental programming and the long-lasting effects of early nutritional deprivation. Furthermore, studies on fasting and its effects on health have also contributed to our understanding of nutrition and disease prevention. Fasting refers to the practice of abstaining from food intake for a specified period. In recent years, Intermittent fasting has gained popularity as a dietary strategy for weight management and potential health benefits. Scientific investigations on fasting have suggested that it may have positive effects on cardiovascular health. The connection between fasting and atherosclerosis, the buildup of plaque in arteries, has been explored in studies such as those conducted during the Second World War. Researchers observed that individuals who experienced prolonged fasting or severe calorie restriction during the war had a lower incidence of atherosclerosis compared to those with regular diets. This finding led to the concept of the starvation diet or zero-calorie diet as a potential intervention to inhibit the progression of atherosclerosis. It is important to note that while historical studies have provided valuable insights, it is essential to interpret the findings within the context of their time and limitations. The ethical implications of conducting severe caloric restriction studies today are highly regulated and restricted due to concerns for participant safety and well-being. Modern research on fasting and its potential benefits has continued to expand our knowledge. Studies have explored various forms of intermittent fasting, such as time-restricted feeding or alternate-day fasting, and their effects on metabolism, weight management, and disease risk factors. While intermittent fasting shows promise in certain areas, it is crucial to approach it with caution and consult healthcare professionals for personalized advice, especially for individuals with specific health conditions or dietary requirements. Fasting has long been utilized as a powerful method of political protest, making a statement and raising awareness about social issues. From hunger strikes to spiritual fasts, individuals have employed fasting as a means to achieve political goals, provoke empathy and guilt, and shed light on various causes. In this article, we will explore the political application of fasting and its historical significance in driving social change. Hunger strikes are a form of nonviolent resistance in which individuals refuse to eat as a political act. They aim to draw attention to a specific cause, demand policy changes, or challenge the existing power structures. By willingly subjecting themselves to physical deprivation, hunger strikers hope to emphasize the urgency and importance of their demands. One prominent figure known for his use of fasting as a political tool was Mahatma Gandhi, the leader of the Indian independence movement against British rule. Gandhi undertook several long fasts during his lifetime, utilizing them as acts of political and social protest. His fasting had a profound impact on the British and the Indian population, rallying support for the independence movement and compelling the British to take notice of the Indian people's plight. Another notable example of a hunger strike occurred in 1981 during the Troubles in Northern Ireland. Bobby Sands, a political prisoner and member of the Irish Republican Army, IRA, led the 1981 Irish hunger strike. The hunger strike aimed to secure better rights for Republican prisoners, particularly the recognition of their political status. Sands, who had been elected to the British Parliament, fasted for 66 days before his death. The hunger strike drew significant international attention, and Sands' funeral was attended by approximately 100,000 people. In total, 10 men participated in the hunger strike, with several others dying after enduring prolonged periods without food. Cesar Chavez, an American labor leader and civil rights activist, also utilized fasting as a means of political protest. Chavez, along with the United Farm Workers Union, undertook several spiritual fasts as part of their advocacy for the rights of farm workers. It is important to recognize that the concept of detoxification, often associated with fasting in alternative medicine, is largely a marketing myth. The human body is equipped with its own intricate systems, including the liver and kidneys, which naturally detoxify and eliminate waste products. The notion that fasting can aid in the detoxification process beyond what the body already does is not scientifically substantiated. Thank you for watching this video. For more informative content, please like, share, and subscribe to Dr. Rohit Deshpande's YouTube channel.